Welcome. We're so glad to have you here with us tonight. My name is Christy Horner. I'm the founder and executive director of Courage to Caregivers. Welcome to our next fireside chat in our Caregiver Essentials Series. I'll be bringing Jenny and our guests on here live from the broadcast studio in just a minute. I really wanted to take the time, though, as a caregiver myself to someone living with mental illness, to make a statement about yesterday's events in the world. I feel like we just can't move on without acknowledging that. Um, our hearts are broken by yet another senseless, tragic mass shooting. Our very most sincere sympathies are with the families and their communities facing profound loss over the last few weeks. After incidents of mass violence like these, it's normal to experience emotional distress. And I'll be putting in the chat box just as soon as I complete my statement some resources for anyone seeking additional support. There's one about understanding emotional distress and resources from SAMHSA, as well as how to talk to our loved ones after a disaster for parents, caregivers, and teachers. And if you're having a hard time processing the news, remember professional help is available. Here at Courage to Caregivers, we are always available to talk. You can reach out to us at any time or reach out to SAMHSA's Disaster Distress Helpline. I'll also put that contact information in the chat. This statement by NAMI, Texas, said it beautifully this morning. When tragedies occur, we as a community must seek to understand and address the root causes of these tragedies, and we must not rush to judgment. Often, we can see a rush to explain mass shootings by identifying mental illness as the primary or sole causative factor. In reflecting back, it is essential for us to understand the nature of mental illness. The evidence is very clear. The overwhelming majority of people with mental illness are not violent. In fact, people with mental illness are more likely to be the victims of violence than the perpetrators of it. Less than 10% of shootings nationwide involve people with mental illness. By overstating the risk between gun violence and mental illness, we run the risk of creating further barriers to treatment. People with mental illness may become increasingly reluctant to seek services, as they will fear that society will then draw certain conclusions about them. This is a chance that we simply cannot afford to take. We must take a systemic look at the root causes and exasperating factors of mass shootings in the United States and address these issues head on. So again, we felt like we needed to acknowledge that. Our hearts are with caregivers. We're here to support you, knowing that this might be hard for you. With that, I would like to introduce my colleague, Jenny Woodworth, and she will bring on our guests tonight and introduce them. Thank you again for being with us. Jenny, I will let you take it away.
Okay, thanks, Christy. And welcome to our registrants. Welcome to our fireside chat, the role of the caregiver on the care team, in honor of Mental Health Awareness Month. I am Jenny Woodworth, a licensed social worker and the director of programs for Courage to Caregivers, and I am glad to be with you tonight. So after hearing Christy read that statement and after dwelling, thinking, praying, walking on all the issues that have been happening, I would just ask you to take a breath with me here and now. It helps calm me, helps center me. So in through your nose, and out through your mouth like a big sigh, and then maybe another. Okay. We talk about hard things here, but you aren't alone. So when I met with Dr. Hertzer and Dr. Caldwell earlier in the week, there hadn't been the school shooting, and here we are. And we know, like Christy mentioned, that those that support those with mental illness often face stigma, fear, and shame during these times. We are here to support you, to lift you up, and help you fight stigma, period, in all of these hard times. Reach out to us, your peers, your professionals. You're not alone. Help fight stigma against those with mental illness and work towards policy change. So a little bit of housekeeping before we get started and I introduce our guests here. We are recording our program tonight, but only our presenters will be recorded. We're spotlighted here. We may not have time for live questions yet. If you do have follow-up questions, feel free to add them to the chat. We are monitoring that and they will be deleted following the broadcast, and we'll answer those the best we can. So, or if you want to ask a question anonymously, you can text us at 216-536-7699. Again, that number is 216-536-7699. Know that we did receive questions submitted prior to this event, and we will include as many as we can. We were not able to include all of them in this presentation due to time limitations. You'll likely receive follow-up information that will hopefully assist you further. So let me take just a brief moment to talk to you a little bit about what we do, what Courage to Caregivers does to support family caregivers. We're a nonprofit located in Northeast Ohio. We now serve caregivers nationwide. So wherever you're joining us from tonight, welcome. So our mission is to provide hope, support, and courage to caregivers and loved ones of those living with mental illness. We focus exclusively on the caregiver and see ourselves in the caregiver burnout prevention business. We offer 3 programs, currently at no cost to the participant. All programs are now virtual, and we are again supporting caregivers nationwide. Our one-to-one caregiver peer support program matches caregivers in need with trained volunteers who have experience caring for someone with mental illness. And my shout out is, if you feel compelled to help other caregivers, I always need volunteers for this program. Our weekly support groups are co-facilitated by both a licensed social worker or counselor and a trained peer specialist. Our support group model provides essential tools to build caregivers' resilience. While staffed by professional therapists, we do not provide therapy or counseling. These are more like coaching sessions. And our breathing meditation facilitators are credentialed yoga instructors that incorporate breathing techniques, light yoga movement, guided meditation, and a deep rest, typically in yoga nidra, during our breathing meditation groups. So now I would like to introduce Dr. Stacy Caldwell. Dr. Caldwell is a staff psychologist at the MetroHealth Medical Center in Cleveland, Ohio. She counsels adult patients through an integrative behavioral health and primary care clinic that seeks to provide holistic care. Dr. Caldwell is an affiliate assistant professor in the Case Western Reserve University School of Medicine, providing behavioral health skills, training to family medicine and psychiatry resident doctors. She also provides behavioral health consultation services for clinicians at the International Community Health Center. Dr. Caldwell is also a licensed school psychologist and previously served in school-based settings for 14 years. She's worked with clients across the lifespan, ages 0 to 80 plus. She is a graduate of The Ohio State University and the mom of 2 sons and a grandmother of 2. Welcome, Dr. Caldwell.
Thank you.
Yeah, Dr. John Hertzer is a psychiatrist, director of the Division of Child and Adolescent Psychiatry at University Hospital, and in his practice sees children and adolescents. And John, what would you like to add to your bio tonight?
Well, thank you, Jenny. It's great to be here. Thank you very much for the invitation. It's great to be here with Dr. Caldwell as well. I'm fortunate to be the Division Director for Child and Adolescent Psychiatry at University Hospital's Cleveland Medical Center, where on faculty we have 16 child and adolescent psychiatrists, 6 child and adolescent psychologists. We also are fortunate to have 6 advanced practice nurses. Within our division, we also have training programs in psychology, child and adolescent psychiatry, and a unique training program called the Pediatric Portal Program, which is an opportunity for pediatricians who, at various stages of their careers, have decided they want to get additional training in psychiatry and child and adolescent psychiatry. And so those are the training programs that we have. We have a 10-bed inpatient unit at Rainbow Babies and Children's Hospital. Within the hospital as well, we have a consult liaison service. And then we also have partner with Highland Springs Changes in their partial hospitalization program and intensive outpatient program located in Solon. And then we also have a robust outpatient department with our, many of us are still doing virtual, but our main office is at the Walker Center down near University Circle. So thank you again for the opportunity to be here.
Yeah, Thank you both. Wow, what impressive biographies and resumes, both of you. So I see Christy has been putting in the chat some resources, both regarding talking about tragedies with loved ones, and she's now probably going to start putting other resources in the chat. The ones I'm going to kind of refer to tonight, the first is On Pins and Needles, again, the most recent research study of caregivers of adults with mental illness by the National Alliance for Caregiving. We spent a lot of time researching this, looking at this, in awe of this, because it really validates and supports the work that we think is so essential. The other piece of resource that she's going to add is the Circle of Care guidebook. It's called Circle of Care, a guidebook for mental health caregivers, presented by, again, the NAC and NAMI. This guidebook takes the On Pins and Needles research and gives caregivers tangible tools and resources. So I'm going to be citing those throughout this talk, but know they're in the chat for you to take a look at later. So my first question for both of you, getting an accurate diagnosis and understanding it, that's going to be our first section here. So 46% of Americans will meet the criteria for a diagnosable mental health condition at some time in their lifetime, and that's from Mental Health America. So we recognize that stress, anxiety, fear, and increased loneliness of the pandemic have been hard on everyone, especially on people's mental health. So we've seen stats indicate that a 25 to 30% increase in the prevalence of anxiety and depression that's increased worldwide, and existing mental health disorders have often worsened. I know here at Courage to Caregivers, we've experienced a surge in requests for our services, and I'm sure you all have too. So I wonder, Dr. Caldwell, this question first is for you. So we've spent a lot of time with our caregivers normalizing feelings and emotions, and we know a little stress and anxiety could be normal, especially in these very abnormal times. So when is this a sign, though, of something more serious? How do you know when you or a loved one need professional support?
Yeah, thank you for mentioning just, how much people have struggled during the pandemic. I really believe that it's going to take time, a bit of time, for people to kind of reset and feel like they can kind of get back to a sense of peace and calm again. So thank you for mentioning that. As far as, signs, things to look for, we should develop a concern when we notice a change in a person's everyday habits, and a change, from what, you might consider normal for that individual. So, for example, if a person once spent a lot of time with friends and then, suddenly they're isolating, withdrawing from friends and outings, then that might be a cause for concern. Another example might be, a person who is typically outdoors walking or jogging, and all of a sudden you notice that there's a change from that typical habit. That could be a concern. Other things to pay attention to might be, habits related to sleep and appetite. If there's a significant increase in the amount of time they're sleeping, or a significant decrease, staying awake long hours, that could be cause for concern, as well as changes in appetite, significant decreases or increases. So again, we're kind of looking for anything that would kind of deviate from what is typical for that individual. And then I would also say, in addition to that deviation in behavior from the norm, asking yourself, is this causing distress for the individual? And then it can also cause distress for persons, in their environment, family, other family members or loved ones.
Yeah, caregivers. Yeah, okay, thank you. John, do you have anything to add? Anything else that how you would know when you or a loved one would need professional support?
Yeah, as Dr. Caldwell mentioned, it's the real important factor is how it impairs one's functioning. When I see a child or adolescent, my first question is kind of why you're here in the office. And I ask the parents the same thing. And usually in those first few minutes, you get both kind of the main symptom that they have been experiencing, but you also importantly get a sense of how impairing that symptom has become. Anxiety, for example, avoidance is a big word that we use with anxiety. Anxiety can be very adaptive. Some anxiety can help performance, it can help concentration, it can help overall functioning and well-being. But you reach a point where if the anxiety is heightened in a sustained fashion, functioning is impaired, and particularly with avoidance of social activities, avoidance of school, leading to more isolation. Quick comments about the influence of the pandemic in our child and adolescent population. It was interesting. Initially, March 2020 through May of 2020, our referrals went down. There was some, I think, relief on kids' part to not have to go to school, but then everything else built, the isolation, the not being able to participate in their activities, and everything that accompanied that, and then stress in households with all the ramifications of the pandemic. And then after that, referrals went up, and overall emergency room visits have gone up. Our inpatient beds are at a premium, as they often are even before the pandemic. And specific disorders, depression, anxiety, eating disorders, and obsessive compulsive disorder are 4 examples of conditions, the prevalence of which has increased over the course of the pandemic.
Okay, thank you. So this next question, we may have touched on this a little bit. I just want to put it out there in case there's just anything else we could have missed. So for caregivers, it often starts with noticing that something is off or it doesn't seem quite right with their loved ones. Erratic behavior, again, trouble getting out of bed, that avoidance, missing events that you're talking about. Any other symptoms that caregivers should be on the lookout for, Dr. Hertzer?
Yeah, in the child and adolescent population, heightened irritability. Now, I know that can be part of typical adolescence, but extreme levels of irritability, agitation, that could mean any number of things, such as a mood disorder, also can be indicative of substance use. Wow. It can also be, suggestive of anxiety. So it's our responsibility as clinicians to tease that part out. But the isolation is a key observation to bring to your mental health professional or your primary care doctor. And also, kids have eyes on them throughout the school day, with teachers, and other staff, coaches, other trusted adults in their lives. And that's really good for parents to hear from if there's been abrupt or kind of, changes occurring over the course of several months that they can bring to the parents' attention.
Okay, thank you. Dr. Caldwell, anything to add? Any other symptoms caregivers should be on the lookout for? Oh, you're muted. It's okay.
All right. Okay. Yeah, some things, other things to pay attention to might include changes in hygiene, not showering for many days, not organizing or cleaning one's home environment, perhaps for a long period of time. Another thing that I'm thinking of is something we call disorganized speech or disorganization in thoughts. And so this is where it may be difficult to kind of follow along with the ideas that someone's trying to convey or what they're trying to get across to you. That's another thing to kind of pay attention to. And again, just anything that really kind of deviates from what you know to be typical for your loved one.
Okay, thank you. So the On Pins and Needles study that we've linked in the chat indicated that caregivers have shared that it took an average of 11.8 years to get an accurate mental illness diagnosis. And most commonly, the median is at 8 years. So more than 1 in 10 says it took 16 years or longer, this is 11% of those surveyed, to get to a diagnosis that the caregiver feels is accurate. That can feel like a lifetime when you're in the middle of securing that diagnosis. And if you're following along, that's fact sheet number 5 in the Circle of Care guidebook, getting an accurate diagnosis. So Dr. Caldwell, do you have any insight or tips for caregivers as they navigate this part of the journey, that finding the correct diagnosis?
Yeah, I can share a couple of things, or a few things rather, to consider. The first thing I want to mention is that sometimes healthcare providers might just need a little bit of time to really get to know a client before arriving at a definitive diagnosis. As you all may know, patients sometimes present very differently in a healthcare office than they do in their typical everyday lives. And so that's something to kind of just be aware of. Another thing to think about is that individuals don't necessarily always fit into neatly into a given diagnostic category. They may have what we call atypical presentations or atypical symptoms, again, that don't fit neatly within a category. So sometimes it does take time to really arrive at a precise diagnosis. Another thing that I would ask, everyone to kind of think about is that human beings are what we call dynamic versus static. Okay, and so this means that we are constantly changing. And so this ongoing change means that our symptom presentations may be changing. And again, when a person's symptoms kind of seem to align with one diagnosis because of the change that is taking place within the individual, as well as in the environment, and then there's that interaction between the individual and the environment, that means that the diagnosis can kind of shift over time. And so to give you an example, an individual may initially come in seeming to be at a somewhat moderate level of depression. And then over time, that can change possibly to a more severe form of depression with possibly some suicidal ideation. Or the depression could remain at a moderate level for a long period of time. And this means then that the diagnosis might then again change to what we call a persistent depressive disorder. So those are some things to kind of think about, is that, in terms of change and evolution, a diagnosis, a person may fit into one category, so to speak, at one point in time, and then as in a later stage of development, that diagnosis may need to shift or change. And then one other thing that I do want to mention here real quickly is that sometimes what really matters is that an individual's symptoms are being properly addressed in a treatment plan. And so sometimes, regardless of what the diagnosis is, whether it's bipolar 1, bipolar 2, panic disorder, let's say, for example, a patient really needs support and skill training and emotional regulation. That really matters, right? Regardless of what the precision with the diagnosis. So that's something to also kind of keep in mind, that the specific core needs of the patient are being addressed in a treatment plan.
Wonderful, thank you. Dr. Hertzer, anything to add to those tips and insights as caregivers are securing that accurate diagnosis?
Yes, the mood disorder example that Dr. Caldwell brings up is one that we think about in child and adolescent a lot. A child can have depression at a younger age, which can continue to be depression if left untreated, or particularly when there's a family history of bipolar disorder, the evolution of the diagnostic evolution that Dr. Caldwell mentioned, that could shift into more of a bipolar presentation at a stage in adolescence or early adulthood. So we need to constantly reassess and do what we do at each visit, a review of systems, kind of to find out where things are. And the therapeutic implication here is that if you put somebody on an antidepressant in addition to all the important therapy that they're otherwise receiving, but if medication is decided as a important addition to the treatment plan, there is the risk, particularly if there's a significant family history of bipolar disorder, for that child to kind of shift into more of a manic state. It's not probable, but it's possible. And that's why we need to pay attention to family history, pay attention to symptom presentation, and be mindful of other risk factors for a child who could potentially later become bipolar. those being that there could be psychotic features to their depression, severe psychomotor kind of slowing. It seems counterintuitive because bipolar is more manic and a lot of hyperactivity and other symptoms, of course. But if somebody's depression has an abrupt onset, has psychomotor slowing, has psychotic features to that depression, along with if there's been a history of activation from the antidepressants, increase, behavioral activation or agitation. Those are things that we need to be aware of, share with parents, and they keep us posted. I mean, the idea of caregivers is so important. And in child and adolescent particularly, we rely on the information parents give us, the collateral information teachers are able to provide us, and other trusted adults in the kids' lives.
Okay, thank you. There's that role of the caregiver on the care team. You're getting there, so great. Yeah. Caregivers who might be new to the journey, they spend a significant amount of time both understanding their loved one's diagnosis and finding a support team. So when someone calls us, again, new to that journey, we usually direct caregivers to NAMI or for their outstanding psychoeducational programming, especially their basics and family-to-family training. We have our own caregiver information resource sheets. They're a good place to start. You'll find those on our website. So we've done some work for you. We've found credible resources. They are they are based on diagnosis. So if you have a loved one who's been diagnosed, you're able to click right there and those fact sheets will come up. So first, Dr. Hertzer, any other resources for caregivers to better understand their loved one's signs, symptoms, and diagnosis?
The American Academy of Child and Adolescent Psychiatry website, AACAP, has a section called Facts for Families, which is very similar, Jenny, to what you're describing with NAMI. That really gets to the essentials of diagnoses and touches upon, potential treatment options there. But again, it's called Facts for Families at the American Academy of Child and Adolescent Psychiatry website.
Okay. Thank you. Christy, if you could put that in the chat, aacp.org, Dr. Hertzer?
AACAP.
Oh,
yeah.
Another A, aacap.org. Yeah. Thank you. Dr. Caldwell, any other resources that you're aware of that we haven't covered here yet?
I would say I oftentimes provide families with the NAMI resource as well. And then I would add a similar website, which would be the American Psychological Association, would have a lot of helpful resources for families and caregivers. And other than that, yes, I am also oftentimes looking for additional resources to pass on to families. So your organization and others that I become aware of over time are always valuable for me.
Wonderful. Is that apa.org, Dr. Caldwell?
Yes.
Okay, great. Thank you. Thanks. Christine, you got it. Okay, so we're going to move a little bit this way. Finding the right provider, support team, and treatment. So finding a support team is essential for caregivers and their loved ones living with mental illness. And you can refer to fact sheet 3 and 4 in the Circle of Care guidebook. Again, finding that right provider and communicating with health professionals. So Dr. Caldwell, can you help us make sense of all the medical members of the care team? For example, who can diagnose, who can prescribe, who am I seeing for therapy? Help. It can be overwhelming in the beginning. How would you broach the subject with someone who's, again, just starting that journey of being a caregiver of someone with mental illness?
Okay. Yeah, so there could be many different members of the care team, of course. So to start off with, psychiatrists like Dr. Hertzer are medical doctors, MDs, who are able to both diagnose as well as prescribe medications that could be helpful for mood symptoms and in a large variety of conditions. And under the kind of umbrella of psychiatry, there are nurse practitioners, advanced nurse practitioners, who specialize in psychiatric care, and they also are able to diagnose and prescribe medications. There are psychologists who, like myself, who we have training at the PhD level. We do not prescribe medications, but we're able to offer psychotherapy services, as well as many of us oftentimes will be able to offer psychological evaluations, which can help sometimes arrive at or help clarify diagnoses. There are oftentimes licensed social workers who may be a part of the team who provide psychotherapy services and some diagnoses. Let's see, licensed social workers, licensed professional counselors who provide psychotherapy services and some diagnosis. So yeah, a large variety of providers that could be a part of the healthcare team. I also just want to mention primary care providers as well. They are oftentimes the first line or the first, healthcare professional that patients oftentimes present to and feel comfortable with sharing mental health concerns. And typically this is because an internal medicine doctor, a family medicine doctor is someone who's perhaps established a long-term relationship with a patient. And so patients oftentimes feel very comfortable speaking with them about mental health concerns. And so, this is definitely a person on the team who patients can feel comfortable talking with.
Yeah, great point. Dr. Hertzer, anything to add? Anybody else on the care team?
Yeah, primary care doctors, pediatricians, I've read recently that about a third of pediatric visits include some mental health discussions. And in terms of the, patients that are being seen. And so they are very experienced in getting the referral process started. And importantly, to their credit, pediatricians more and more are beginning treatment when medication is appropriate for certain conditions, not all, but we rely on them in terms of absolutely being the frontline first person to be able to identify. And there's required screenings within the pediatrician's office, specifically annual screenings for depression, and more frequently too, depending on what the presenting complaint for a pediatric well visit or other visit entails. I see that there's a question in the chat and from my previous comment about what are some psychotic features to depression. Specifically, I'll mention mood congruent hallucinations. So these can be a patient saying that they're hearing voices, kind of negative voices, negative thoughts, sometimes command in nature. Some, they can vary, but the point being that it occurs within the mood episode, depressive episode, as I was talking about earlier, and they are mood congruent. They are very consistent with what they're hearing with depressive thoughts.
Thank you. So we know there's a shortage of behavioral health staffing, and we've heard it can take weeks to get a new appointment with the provider. Dr. Hertzer, do you have any tips for finding a provider and getting on that schedule?
I'll reiterate, pediatricians, they have good referral list. And, we need to have options because availability in a particular place can vary depending on somebody's caseload, how many people in that practice. Insurance plays a role in this, who's on their insurance panels. We have wonderful community mental health agencies in our area for patients who have Medicaid and CareSource, for example. So we, and then, university hospitals, insurance-wise, we see pretty much everything. So that usually is not a limiting factor, but that's more so in private practice. So we have a very nice mix of private practices, community mental health agencies, and academic medical centers in our region. But I know it can become frustrating for people because it's fluid in terms of availability at a particular place. So it's talking to the pediatrician, it's persistence in making phone calls, it's sometimes leaning on the insurance company to help guide one in terms of what place is on their plan.
Yeah, and that's a great point. That is part of their job, essentially. So you can call your insurance agency and talk to them about, help them screen who would be available under your insurance. Dr. Caldwell, anything to add?
Yeah, I would agree with both Dr. Hertzer and you, Jenny, just reaching out to the insurance company, getting a good list of providers in the community and making some phone calls. And I'd say, again, like Dr. Hertzer said, caseloads vary from organization to organization, different seasons of the year. So you might be surprised to actually find that some organizations may have openings for initial assessments within a 2-week time frame. Myself, just calling around and assisting patients, I've noticed that at times. And again, as we've mentioned earlier, primary care providers are oftentimes, frontline providers for initially addressing some of these concerns. Oftentimes they have a network of supports that they could also assist their patients with sort of accessing. So that's an option as well, is to reach out to that primary care provider.
Great, thank you. I'm going to move and talk about the care plan a little bit. And in that Circle of Care guidebook, there's fact sheet 6, hospital discharge planning, and fact sheet 10, planning for the future. And there's an emphasis here on the importance, again, of that support network and care coordination. And in the chat, we'll be linking for Like Minds, a really great collaborative care plan that is fillable. You can use it for yourself. And then also NAMI's guide to navigating a mental illness crisis will also be linked there. So Dr. Caldwell, as caregivers support their loved ones with a new or emerging diagnosis, how can they provide support to their loved ones as they seek care for mental illness?
Yeah, there's several things that I would mention. So one would be validation. The other is encouragement. The next is presence. And then finally, I would say something in the psychology world that we refer to as unconditional positive regard. Okay. So when I say validation, I mean letting your loved one know that you see their challenges and that it's okay to feel stressed or challenged and overwhelmed when life circumstances become too difficult to manage. Of course, encouragement, encouraging them and acknowledging that they've taken, possibly a very challenging step forward when they go to seek out care, because sometimes that is quite challenging for many individuals. And again, being present in all the wonderful ways that caregivers tend to be very present, right? Accompanying their loved ones to medical visits, helping seek out resources and making calls. And again, as the loved one, is open to this and kind of meeting them at the place of their need and kind of getting a feel for their comfort level of how much support they would like versus, how much do they want you to move forward versus pull back. And sometimes that can be kind of a balancing act for caregivers as well. And then when I mentioned this term from the psychology world, unconditional positive regard, is just this sense of letting our loved one know that they're valued no matter what they may be struggling with, and that they are a valuable person just because they are who they are and that they matter to you. So I would say those are all some very important ways to really show support.
Oh, that's really beautiful. Thank you. Dr. Hertzer, anything to add here?
Yeah, the child adolescent supervision and safety, it can make the difference between somebody who may require to be in the hospital because of the acuity of their presentation and those who may not. So that's an ongoing dialogue that we have. If somebody's depressed and feeling suicidal, that does not automatically mean that they need to go to the hospital. It depends on the level of support and supervision that's around them within the home, and the frequency of outpatient visits that we can achieve. So it's always an ongoing dialogue. So everything that Dr. Caldwell mentioned, and then that added piece about safety and supervision.
Great, thank you. So, what about those living with mental illness who are not adhering to a care plan or just refusing care? And got a kind of a question just about an hour before the presentation. So, for example, like this person is hoping to hear kind of about a best course of action if you strongly suspect there's a serious health issue, and the adult child refuses to do anything about it, and that person is under your roof, so they're not using medication, they're not going to counseling. So this is kind of where we get a little bit of division, Dr. Hertzer, so what about this question for those that are under 18, if they're not adhering to a care plan or refusing care, and Dr. Caldwell will get you for those people over 18. So Dr. Hertzer, for adolescents and children, how do you support caregivers when they have their loved one is not adhering to a care plan or refusing care?
Well, sometimes I take a different approach in the office visit itself. I mean, there's, kind of standard interviews that we do, but when that child or adolescent is not engaged, sometimes I just throw that, aside, and I just try to sit there with the child. And namely, one example is to find out if that child and adolescent has future goals that he or she wants to achieve, and to try to tie what we're trying to do to help that child or adolescent within things that are important to that person. And sometimes that helps, sometimes that doesn't, but it's kind of within the motivational interviewing realm approach. So every visit, every person is unique, and sometimes kind of standard approaches do not achieve what we want, and so we kind of modify things.
Okay, great. And Dr. Caldwell, what about for adults? I think this is really frustrating for this person that sent this question in, and for other caregivers that are caring for someone with mental illness and they are over 18. They're adult children or some other relationship of care. So especially if you can speak to, what do you do if you suspect that there's a mental illness and that person is just not doing anything about it? Any tips of advice for this person that sent the question in?
Yeah, and I first want to just acknowledge that I know this can be one of the most challenging situations of all that caregivers have to face. It can feel pretty discouraging when you know that resources are finally available and accessible, and then it seems that the loved one just kind of wants to opt out of using those supports and services. So, I guess in a similar vein of what Dr. Hertzer mentioned, the relationship building that we do within the office with patients and clients is very important, of letting them know that we are all trying to collaborate on the best plan of care. And I really like Dr. Hertzer's idea of getting an idea of what the individual wants for their future. And it's kind of like helping them to kind of look at the pros and cons. What are the pros of seeking treatment? What are the cons of seeking treatment? How might it benefit you in terms of reaching your goals or getting what you want out of life if you were to seek treatment? And then I would say in perhaps a smaller percentage of cases, there may be situations where, adults are at risk for harming themselves or others. And so in those kind of, perhaps more rare circumstances, it may be possible to ask a probate court to sort of mandate treatment. We always hope that that's a last resort, obviously, but that is one option, especially if we're running into a situation where we really are concerned about the loved one's physical well-being or the physical well-being of others.
Okay, thank you. So at Courage to Caregivers, we believe the role of the caregiver and the care team for those living with mental illness is essential. And, taking people to appointments, medication, accountability, ongoing support, again, that presence, the unconditional positive regard. There's other things that Dr. Caldwell mentioned. all essential. And I'm looking, if you want to refer to fact sheet 11, this is the confidentiality and family involvement section. So first up, Dr. Hertzer, how do you work with families, and what do you see as the role of the caregiver on the care team?
Everything that you just mentioned.
Yeah.
Support, supervision, obviously, if there's medication involved, assisting with medication adherence, which is so important. And kind of being, also being able to share with, the other people in the lives, whether it's other parents that, may notice some things, whether it's teachers or other personnel in the school, but to really be our most important source of information, whether it's through their direct observation or what they're able to hear from other important adults in their children's lives.
Okay, excellent. And Dr. Caldwell, I know specifically that working with adults makes including the caregiver on the care team a bit more challenging due to privacy rules and other barriers. How do you best incorporate the caregiver on the care team when you work with adults?
Yeah, so I start with a conversation typically with the patient, explaining my role and how the healthcare team functions. I like to think of the healthcare team as sort of forming a circle around the patient, and just really try to emphasize that the idea of, again, teamwork with the caregiver included. I also try to just get an understanding of what a patient wants, right? I try to really emphasize that their needs and their opinions matter. And then I also ask if they would be willing to sign what we call a release of information form, so that the caregiver can be included in any future conversations and appointments as needed. So.
I've heard that, caregivers can talk to you and report to you, but you may not necessarily report to them. Can you elaborate more on that? Is that a correct assumption of caregivers?
Mm-hmm.
Okay.
Yes. And oftentimes where I tend to see that situation arise is when a caregiver might typically have a very serious concern about their loved one's safety. So again, caregivers are able to contact providers. However, just remember that a provider, because of privacy, confidentiality, HIPAA, and so forth, providers are not ever in a position where they're able to disclose or share specific information about any of their clients unless a client, expressly, specifically provides written consent for that to happen. But again, however, a provider is permitted to receive and listen to information, and providers, mental health providers across agencies, you can always seek them out just for general information and ideas and suggestions on how to support your loved one.
Ah, wonderful. Well, we have another question specifically for you, and this kind of what you just said feeds into that. So what's the best way to communicate with the care team when you are that parent of an adult child? Kind of with the goal of understanding how to make sure you're supporting therapy goals, not enabling. I think especially if that loved one has maybe not been so forthcoming with what those therapy goals are. Any advice for that person?
Actually, in your question, I think is a perfect example of how you could actually talk to the care team. So, literally, you could just say to the provider in front of you, I'd like to know how I can support my son, my daughter, my sister, my brother with their goals without enabling them, right? Or otherwise hindering them from reaching those goals. So how can I best be a support? So I think, again, exactly what you said is perfect in terms of how you would state that and be very direct. I think many providers are happy to hear and to know that our patients have someone else who's with them in environments that we can't be with, where we can't be with them, and that can provide that additional support.
Great. Wonderful. Thank you. So last but not least, we definitely don't mean this to be last. We're going to talk a little bit about caring for the caregiver. So, we can't close out a program on the role of the caregiver on the care team without acknowledging how important it is for the caregiver to take care of themselves. So we have those 3 programs I mentioned in the beginning. There is a registration on our website. You can also reach out to us at our phone number that we mentioned earlier. We have our website, couragetocaregivers.org, which is loaded with resources. We have those caregiver information sheets that we mentioned mentioned earlier on the slides or during our conversation. And yeah, so this is fact sheet 12 in that Circle of Care guidebook, taking care of yourself. So we have our tips, we have our tricks, we have our programs, but Dr. Hertzer, any other tips for caregivers on how to best take care of themselves through the journey of supporting someone living with a mental health diagnosis?
Wellness is so important to all of us, and kind of the triad of wellness that I share with my patients, and it applies to caregivers as well. Nutrition, exercise, sleep, those are invaluable. And if those aren't right, it can really interfere with our treatment with the child and adolescent. And accordingly, if a parent is not engaging in wellness, and I say parent, but that can be guardian, that can be, whoever the kind of caregiver is, because there can be any number of people who serve as caregivers, that getting, wellness is important. And also family history, as I mentioned at the outset of the program, is something that we really pay attention to. There are times where a child may be treated for a particular condition, and over the course of the conversations, we learn that the parent may need, or guardian or caregiver may need similar treatment. And we get those referrals in place. And that's, really how it should be, that over the course of our conversation, if there's things that a caregiver wants to seek treatment for, we really encourage them to ask us about it, and we can get referrals going for that.
Okay, wonderful. Dr. Caldwell, any tips from you for caregivers on how to best take care of themselves?
Yeah, one thing I would say is that caregivers, it's important for caregivers to allow themselves to feel grief for any changes that they may be experiencing. Sometimes there may be a loss of certain, hopes or certain expectations they may have had. And so, yeah, just allowing oneself to feel and experience grief or loss. The other is to pay attention to think your thoughts, your mindset, right? So any thoughts that may be limiting you from caring for yourself, maybe the idea that I have to be there 24/7, or, I can't allow anyone else to step in and care for my loved one because, that would just be too hard for them to accept. I need to be the one to do it. So anything that you might be believing that's kind of limiting you from taking time out to kind of care for yourself. Yeah, and just gathering, your own support system as much as possible.
Yeah. Fighting against that isolation and stigma. I think that's a huge part of this. Well, those of you that are watching live, if you have any questions, this is the end of our planned questions. So feel free to put those in the chat. We'll wait for just a minute or two. And Dr. Caldwell, Dr. Hertzer, thank you so much. I mean, it's obvious that you both are amazing clinicians and also amazing humans that really care for your patients. So I appreciate you sharing your knowledge with us and doing this on a Wednesday night in May when the weather is amazing in Northeast Ohio. So thank you both so much.
Thank you, Jenny.
Yeah.
Thank you for having us.
Welcome. hang out for just a minute.